Welcome everyone to our third community conversation on bias in public health data. Today we're going to be focusing on trust. And to get us started, we're going to welcome Brian Dillard, our Chief Innovation Officer from the City of San Antonio, and Jonathan Butler, our Equity Manager from the Office of Equity.
Awesome. Thank you, Leslie. So I'm Brian Dillard. I'm the Chief Innovation Officer for the City of San Antonio. And yes, thank you for attending our third of three, the three-part series on community conversations, bias in public health data, where we're trying to understand what we're doing right, but also where we're missing the mark a little bit from your perspective as community members and how we can do better. I think it's very important to always harp in on the fact that good leadership shows humility and understanding that you're not always perfect. And I think the City of San Antonio does a great job of that across the board when it comes to our residents and understanding we can always do better. So that's what these community conversations are about. So one, thank you for joining, but thank you for, again, participating. If you've watched the last two, you'll know I always kick this off by harping in on that word, participating. It's very important that if you don't participate here in this discussion, you leave us feedback at the end. We'll have case studies posted for you. So definitely that's what this is about. It's about the conversation piece and providing feedback. Thank you to Geekdom and our CivTechSA team. Eddie and Leslie done an amazing job of putting these series together. So I'm really excited about doing these on other topics as we move forward. Thank you to our esteemed panelists. We've got some really smart people, make me look super dumb, which isn't difficult to do. Thank you to Metro Health. We definitely appreciate our San Antonio Metro Health Department. Man, they've been hustling forever, but they've definitely been hustling over these last 6-7 months. So for them to allow us to do this and participate with us and give us the guidance and leadership we needed to make these conversations happen is very valuable. And then finally is thank you to council, mayor, and our city management for allowing us to have these conversations. Again, humility is something that a lot of times isn't really embraced, and we definitely thank them for allowing us to have these conversations. So why are we here? If you've been tuned into the last two conversations, you can just go for a bio break right now while I go through this. Why are we here? So we know that systemic change starts with data. That's really the root of how policies are made, how services are provided, or determined where to be provided and who to be provided to. So data is very important. We really want to focus in on kind of three factors here when we talk about data. So the collection of it, so whether that be surveys or how your medical provider absorbs that information and provides it to municipal government. So the collection of data, processing of data. So how is that data processed on the back end? How is the city absorbing that? How is your medical provider absorbing it? Where are they storing that? And then third is the utilization of it. So what happens? Why are you collecting all this data on me? And we talk about policy making, talk about providing services to the community, where we do that, how we do that. It's really the determining factor. So collect, process, and utilize. We're parsing that out over these three conversations. If you missed the last two, they're recorded, they're online. Go back and check them out. The first one was on identity. So how do we identify and how are we counted within that data as individuals, as communities, as demographics? The second was reach. So understanding how is the city, how are health providers, how are we engaging those community members? How are we getting out there, making sure bias doesn't create barriers to that, whether that be digital divide or just kind of lack of awareness. And then the third, the one we're discussing today, is on trust. Okay, cool. We identified who is providing that information and how are we getting that information. But then now today we're getting into the fun conversation of, all right, what the hell are you going to do with all that? So I'm excited to have this conversation. I'm excited to have these folks on the panel engage with us and letting us know their thoughts on it, having the back and forth. Now you're probably wondering, as community members, what does this have to do with me? I'm not a doctor, I'm not a PhD, I'm not in health profession. What does this have to do with me? Well, the city of San Antonio can't assume that we represent all community members across the 1.5 million residents that reside within the city. That's where you come in. We want to make sure this isn't just an internal conversation and we're not operating in silos or vacuums of our own knowledge. We need your expertise, your experiences, your day-to-days. We need those injected into our conversations so we can better understand how to provide better services to you day after day, year after year. That's where we're at. I think I covered it all. Did I miss anything, Leslie? Okay, cool. I'm gonna hand it over to Jonathan Butler from our Office of Equity. Hey, JB.
Thank you, Brian. Always a pleasure to be here with you. Thanks to you personally and your office. Whenever we're invited to the party, we just feel like it's wonderful to be associated with you all, and particularly talking about a topic that, as a person who works a lot in community and has throughout my career, trust is extraordinarily important. One of my colleagues once said that we only move at the speed of trust. And so in this climate and understanding some of the challenges that we are currently dealing with and what the new challenges will be as we move forward, continuing to progress in the avenues of trust are extraordinarily important. I want to just take a moment of personal privilege and thank Dr. Bridger for her leadership of our team. She has been instrumental in helping us integrate ourselves effectively into the fabric of the city of San Antonio and our operations. And in our office, the Office of Equity is built to normalize, organize, and operationalize all of those things that we talk about in building a more equitable city government and community as we speak. And so I just want to thank you all and thank Geekdom and thank your team as we work collectively together to really take data and do something extraordinarily with it, and really take data to round out and make us all aware and understand where the challenges are, who are those persons in most need, what are communities of color and lower income communities in need of, and how we can better engineer our services to that point. So with that said, Joyce, I am looking forward to hearing the panelists, and I will turn it back over to you all. Thank you again.
Great, yeah. So thank you so much, Brian. Thank you so much, Jonathan. Having both of you kind of set this up, give a little more context as to why we're here today is just so important. So thank you very much for joining us. And now I'm going to introduce Joyce Deuley. She's a program manager here at Geekdom, and she has been part of the CivTech program for many years now, kicking it off in year one. And she's also very involved in our community, just always on top of important topics like this. So Joyce, take it away.
Thank you so much, Leslie. You know, everyone, this is just such a fantastic experience already. And I know we haven't even really dived into the meat of the matter and what we're really going to be talking about today, which is trust in data. But I want to commend everybody who has put in a lot of work to put these panels together, and it's a real treat to be able to come in and moderate this with you guys. As Leslie said, I'm one of the program managers here at Geekdom. I have a background in emerging technologies as an analyst, focusing on things like AI and data science and blockchain and smart cities and those kinds of things. And that's kind of how I got led into CivTechSA. And now I'm working on innovation projects here at Geekdom. But this isn't about me. You know, Brian and Jonathan did a really great job of synthesizing what the last two discussions were about and setting the frame for today. And so I just want to reframe that a little bit with the sense that, you know, we talked about identity and reach to demonstrate like how the tools we use to collect information can pigeonhole us, and how nuanced identity is beyond genetics, as well as the complexity of sharing information, how pervasive it is in our current culture, which leading into how being empowered by data that's collected about us is really what's critical to be like. We need to be transparent about what we're collecting and how we're going to be applying that, especially when we start looking at things in scale. And Jonathan, I couldn't agree with you more. You know, we move at the speed of trust is just a really fantastic way to set the tone for this. And I'm clearly not going to be the expert in this panel, so I'm really excited to introduce our speakers to you today. Our first speaker that's going to be coming up is Dr. Colleen Bridger. She's the Assistant City Manager of the City of San Antonio. She's also the Interim Director of the Metropolitan Health District. She oversees Parks and Recreation in the Department of Human Services. We are incredibly grateful for her leadership, and we really look forward to what she has to say. Our second speaker is Dr. Darisha Kudithapudi. I'm hoping that I did her justice with that. She's a UTSA professor. She's a Robert F. McDermott Endowed Chair member. She's also the director of the AI Consortium here in town. Her thought leadership is pretty exceptional, and so this is a real treat to have her participate as well today. And then our final speaker is going to be Suja Kama with Funnel AI. So Suja has a pretty wonderful background as a geneticist. She's had a varied life going from bio-life sciences into now the entrepreneurial space. She's the co-founder of Funnel AI, and she's also a thought leader on data science and diversity here in San Antonio and abroad. And with that, Dr. Bridger, I would love it for you to just take it from me and then share with everybody else what you've got going on.
Oh, what I've got going on, I don't think y'all want to hear about that. Let's skip the whole pandemic thing and move to trust in data. I was excited to be asked to participate on this. I had what was, I guess, on their end, a bit of an awkward conversation because they were afraid that the health department wouldn't be willing to release some of their previous data analyses or data projects as a way to improve how we do what we do. But we are always interested in improving what we do and how we do it. And at the heart of everything that we do is data, right? We are a science-driven field. And so it's interesting when you're in school and you're learning about how do you analyze data. Often programs don't stop and take that step back and say, and here's what you need to think about communicating about how you're going to use this data. We often miss that part in our conversation with the community. And so I was glad to hear that that came up. And, you know, I don't want to spend too much time just talking into the Zoomerverse, but there are some principles that we do adhere to at the health department and some things that we are working on at the health department, both with our external data collection and our internal data collection. So, you know, just wanted to highlight a little bit of that. We were actually one of the very first health departments in the nation to report out about COVID-19 cases by race and ethnicity. That was not something, and in fact, often the challenge that we have with reporting out about data is HIPAA. It always feels like HIPAA keeps body slamming us back to, no, you can't say that. No, you can't release that. No, somebody might know who that is. You can't use that. And so we have to figure out how to be a little bit more nimble on our feet and navigate through HIPAA so that we can use the data, communicate the data, help people understand how we're using that data in such a way that's still in compliance with HIPAA. But we did go out on a limb and say, we are going to report our cases by race and ethnicity. And that opened the door for everybody else to do it, because the first pushback we got was, no, you can't do that because of HIPAA. So, you know, it takes, it's funny, you never think about data and risk taking in the same thought, but it takes some risk to be able to not just collect that data, but then release that data and use that data in a way that's beneficial to the community. And the other challenge that we deal with is how do you collect that data in a low trust environment, and how do you use that data in a way that doesn't feel like you're ostracizing the people that you just convinced to give you their data? Because that's how it often comes across is, oh, people of color have worse health outcomes. Well, what are they doing wrong? And so that's the challenge that we need to figure out. So it's not just about, I mean, it's just, everything's just so complicated, right? It's not just about collecting the right data, releasing the right data at the right time to the right people, but it's about framing how you release that data at the right time to the right people so that it doesn't feel like you're piling on to the systemic racism that has led to these challenges that we're dealing with health outcomes. So that's some of the stuff that swirls around in my head about this that we try to figure out how to overcome. And I'm really excited about this forum to help us think creatively and outside our little HIPAA boxes about how we can do that and do that effectively with the community and not necessarily to the community, which I think has been the approach of public health in the past. The only other thing I want to talk about before I turn it over to the next speaker is this internal data collection process. So I think organizations in general tend to think that if you're a manager, you know more than frontline staff know about how to fix problems in your organization. And I think the corollary is clear between internal and external, right? We are experts. We think we know how to fix the problems in the community. But I also think that it's really important for the health department to walk that walk, both internally and externally. And so when we go through community engagement exercise or employee engagement exercises, and we identify challenges in the health department, we pull together non-supervisory staff to strategize solutions to those problems. And that makes our managers very nervous. And I will say that this community conversation about how to use data can make some of our public health experts very nervous because we're losing control. But that's absolutely what we need to do in order to accomplish the outcomes we're looking to accomplish, is let go of some of that control, let the people who are affected by the decisions we make drive this bus. And that's hard for us to do. So thank you for pushing us outside our comfort zone and encouraging us to let the people who have the lived experience, whether it be inside the health department or in the community, drive that bus to where they think we need to go. So with that, I will turn it back over to our facilitator because I'm not sure who the next speaker is.
No, thank you so much, Dr. Bridger. You brought up so many fantastic points, and I know that this is going to be a really great launch pad for the following discussion. So we appreciate you, being the first one out the gate. And I'm so excited to have Dr. Darisha Kudipudi join us to talk about her presentation as well and get her perspectives.
Can you see my screen?
Yes, ma'am.
Okay. Thank you for inviting me to talk about this very important topic. As the director of the AI consortium, designing trustworthy AI systems is very, very important in our consortium. So like Dr. Bridger said, one of the very important phases within a design space, for the AI is the data collection. You could think of data as the food that you're giving to your AI system that is spewing out some decisions. So if I really break it down into very high level phases, we have the data collection, the data pre-processing, AI models that we use to take that data and give out some decisions, whether the healthcare providers, caregivers, or different community members are going to use. And these outputs could be used to make a prognosis for a disease, understand, for example, the current pandemic, predictions on those kinds of scenarios, and several other cases. So the data collection is really an integral phase in this design flow. So Dr. Bridger has mentioned one side of this challenge of data collection and data visualization, but really the R&D houses or the basic science that happens in academia is relying on data that is collected from various sources. For example, in the healthcare domain, it could be your personal health data. It could also be secondary systems that, such as like the face recognition data or the social network or social media data that you have. And if you're using different types of bio trackers on yourself, there could be different types of data that is collected from these devices. So it is amazing that you have so many modalities of data, but that's where the challenge comes in, right? Let's consider the healthcare data or health data. It could be inherently noisy because of the way the data is collected, because of non-standardized modalities in which data is collected. And this is actually one of the phases where human engagement is very high. So human is still in the loop in the data collection process. And the other challenge, if you're looking at, for example, the facial recognition systems that we're using, there is a lot of bias against minority populations. You might have read this news in popular press quite a bit. The reason is that there is a lot of underrepresentation and undersampling of data that is collected for minority populations. So the data that is collected for the majority population is used in the algorithms to make certain decisions, and that may not be representative of the minority groups. And it is just not, impacting just the minority populations. It could also be geographical locations. Depending on where you are located geographically, certain data points might not have been collected. So there is imbalance in the type of data that we might have collected. So a small county versus a big county. In the current pandemic, there were a lot of cases where, for example, data was not really collected on the issues that were happening in border towns across the states and several other things. So there could be undersampling in that. And the important thing, because this is a process where human is engaged, there is lack of diversity and use of domain experts. What I mean by that is there is some kind of disciplinary silo still in how we are collecting data, in a sense that there is an AI scientist or a computer scientist or engineer who is more at the front lines in building these and collecting this data. But then you also need to engage with the healthcare providers, the community, exactly as this conversation is happening today, or the different healthcare partners that are going to be impacted in this process to ensure that we address these challenges. And one could hope that all the mishaps that we did, or all the things that we missed in the data collection process, as Brian mentioned, data processing is a very important step in making these decisions. But what happens is whatever we did in the data collection phase just gets amplified in the data pre-processing phase. So whatever undersampling we have done, yes, we are going to clean up the data in a way that it is very useful to feed into our models or algorithms, but the undersampling will still remain. So really these siloed ways of collecting data or input streams is going to accelerate our concerns or challenges. So this is the front end. So the food we are giving to the algorithm is not truly representative of the diverse society we have, and that is where the biases are coming in. But also the biases could come in because of the type of models I choose as an AI designer. So a lot of times, all that data that I given from the pre-processing is going into this black box model. And folks from businesses and industry are, in a lot of scenarios, deploying these black box AI models, and without understanding what is happening inside the algorithm or how the algorithm is actually using this data stream. So, and that is fair enough because everybody is not going to be an AI scientist. So it is really the responsibility of the researchers or at the Matrix or any other AI community to kind of design this new generation of algorithms that are fair and explainable. So because right now, as a AI scientist or as a healthcare provider, I cannot clearly say why a certain decision is being spewed out by this AI system. Why it is predicted that this person has a higher chance of cancer, or this person has a higher chance of certain life-threatening disease. There is no clear guarantee I could give that the system's prediction is right. Whereas if you can design a system that can explain how that decision is made, the trust that humans will have in that system will grow significantly. And that could have an advantage in how fast we can kind of make these predictions. In some cases, there is like 40% of acceleration that we could have in how these predictions are made. So it could have a significant impact. And if we have to give the current scenario as an example, there are a lot of these data collection, imbalanced data collection that happen that worsen the predictions for people of color or different ethnicities. So we are trying to build these models, and this is a really an ongoing and active research area in Matrix and in general in the AI community, in trying to build AI that is understandable and explainable by reducing the biases in the front end, but also building AI models that can actually explain or reason out why they made certain decisions. It's not an easy challenge. It's one of the grand challenges of the field, but I think it is very, very important if we want humans to trust and use these systems in mission critical or life critical scenarios. So one example we have done is that use this kind of system, you can think of a smart health home, and particularly in San Antonio, you can think of intergenerational homes, very diverse intergenerational homes that could have different types of, for example, fitness markers or activity trackers or biomarkers. All this data is collected, and also you could have cameras and sensors that are collecting how an elderly population is responding to certain inputs, or also how they are doing throughout the day, and all their health conditions can be monitored. And you can only imagine the challenges that come when you have such a test bed, or businesses or companies that are trying to promote or support elderly populations with certain such test beds. The reason I say it's a challenge, one, we've talked about what can happen with underrepresentation. All of those challenges come in. So when I take in, for example, these biomarker or activity tracker data, which is inherently noisy to some degree, and feed into my AI system and make a certain decision on the condition of the person in that home. But what happened was the activity tracker made that decision based on data that is not representative of the population that I'm targeting towards. So it is not being inclusive. So the decisions could be not representative. So that is just one example. And then you could also have scenarios where I'm collecting this data saying that I'm going to use it to help you in a certain scenario, and I could use it in a different scenario. And a lot of times, we as users might not understand. So it's important to have these community conversations to educate our broader San Antonio community. So, and I can talk more about this in the discussion. I'll stop there, but I think there is a lot of opportunity to build these trustworthy systems, and Matrix will definitely be on the front lines for that. Thank you.
Thank you so much. That was incredibly informative, and it was a really great way to kind of look at the framework or the structure of how these things are being collected and put together and synthesized for those results. I really enjoyed hearing what you had to talk about with the models, and how that's just as important as how you collect that information and who you collect that information from, and all of the other things about the info or the data itself. But how you process it, how you structure it is just as relevant, if not more relevant at times, depending on what you're doing. So thank you for that. And our final speaker before we get into the open discussion is Suja. Suja, are you ready to go?
Yes, Joyce, can you share my presentation, please?
Absolutely, I can. Yeah, no worries.
Much. Thanks,
Okay.
Joyce. Hi, everyone. Yeah, thank you for having me. I'm Sujat Khamma. I'm the co-founder of Funnel AI, which is an AI startup based in Texas. But I'm also an organizational leader in healthcare for 22 years. Genetics and genomics is my background. And I am a strong advocate and also a believer of data culture in organizations. Joyce, can you go to the next slide, please? So with regards to the trust in healthcare, I think Dr. Bridget and Dr. Kurutipudi covered it very well. The need for inclusivity, that includes everyone in the healthcare system has to be a part of this process. And we have seen success. I have seen success being a healthcare leader here in Canada, the province of Alberta, when we included everyone. I mean, that includes the administrators, the healthcare providers, the physicians, the patients, even the maintenance, staff. Everyone, the data needs to be. Everyone needs to be on board with regards to how the data is collected, what's collected. And the second important thing about data and then gathering data and building trust is diversity, whether it's diversity in skill sets or diversity in the people on the team, and also lived experiences. I think that's very, very important. I think Dr. Kurutipudi has explained extremely well, and then she gave a really a broad overview of how AI and data is collected and how biases are influenced. And I think in order to build a really trustworthy data culture organization, I think we all need to acknowledge the conscientious, unconscientious, and also the cognitive biases that we have in the systems right now. And they do exist for various reasons, because I think in the healthcare world, we do this random standardization and treatments targeted to larger groups and predominant groups. I mean, that's what, some of the minorities may be excluded, or how the data collected varies from system to system. Joyce, can you go to the next slide, please? Thank you. So I had this slide on understanding how to build trust. A general broad overview of what helped us and me as a healthcare leader is starting from the foundation, is building and understanding what the issue is, and also increasing the awareness that we have the issue within the healthcare system. And how do you mitigate that? We mitigate that by gathering the right amount of data, and also understanding what information do we need. So what we're going to be collecting is based on what are the outcomes that we're going to be looking for. And so the outcomes can be policy, sustainability, adaptability of the system, and it's also health outcomes for the patients, and even nudging patients for advocacy in healthcare. And we also need to measure and plan for the performances outcomes when we are trying to build systems. Joyce, can you go to the next slide, please? I think Dr. Kurutipudi explained quite comprehensively with regards to data. I will focus my explanation on AI and data. So when we talk about data, some people have different understandings of what that is. I mean, data is nothing but information. So AI is used in healthcare in various ways, whether it is understanding a disease progression or understanding a patient journey, understanding continuity of care, understanding how a healthcare system is going to be sustainable, and how the healthcare system can be efficient in the long run. So, and then there's also engagement tools in improving the health outcomes of the patients. However, for us to collect the appropriateness of the data, we also need to understand a few infrastructure details, which is, I think we need to put an emphasis on letting the people know what data we are collecting, and they also need to be a transparency of how we are going to be collecting the data. And I won't say most organizations, but we haven't put a lot of emphasis on security, on the privacy of the data. Now with everyone going digital in this COVID era, I think the security aspect of the data and the data storage has been enhanced. So I think what the organizations need to do is they need to be prepared. We need to prepare and, trying to improve our talent, have the right people on the team, have the right understanding of, what data is and what the outcomes that we are looking for, and how we are going to share it and how we are going to store it, and also increase the security. I think we need to build various levels of infrastructure, the resources, our understanding, and also our infrastructure. Joyce, can you go to the last slide, please? There is a reason why we need to build trust in healthcare and using data. And there are different ways of also mitigating biases. The best way to improve trust in a healthcare system is by mitigating biases. I mean, so the biggest question would be, can AI models take over human decision making? I don't think so. There are certain models that we can build, but when we are building models, the few things that we need to consider, we need to establish processes to mitigate biases at every step of the modeling. And we have to be so open to fact-based discussions. If we are not going to create an environment where we will have those open discussions, I don't think we will ever enhance, building that trust level within our teams. And we also have to explore, the areas where AI can be used. Not every area in healthcare decision-making will be replaced by AI. There are certain automated processes. However, in order for us to do well, I think we need to invest in research, invest in diversity, invest in our teams, invest in privacy, and even invest in, I think, sharing the information of what we are doing with data. I think I'll leave with a thought, like we can create automated models. Some of the automated models, yes, we can build efficiencies and also sustainability within our healthcare system. But I think what we need to do as team, whether it's in healthcare or any other organization, I think we need to hold ourselves, a human decision-making, to a higher standard. I think that's when the AI, the data gathering, the trust, models, efficiencies will be held to higher standards. Thank you.
Amazing.
Thanks,
Thank you so much. Yeah, no, thank you. Really appreciate that. So this is just a reminder, if you do have questions, please drop them in the chat before we get to our breakout session. That concludes the panel discussion up until we get to this next part. I know some of you have been leaving some comments. Thank you so much. We did have a couple of questions. So panelists, if you wouldn't mind answering. So thank you, Emily, for saying it's really interesting to think about how a household is equipped with so many different types of technologies that gather data. How can we better inform residents about how these technologies work and the biases they may have? And when is that a public sector versus a private sector responsibility?
I can take that question.
Sure, thank you.
This is a very, very important question in a sense that I think it's overwhelming as a user to see so many technologies that are going to be surrounding you, and to even keep track of how the data that is being collected is used and how it is going to help you in the end as a user. So how do we inform residents, I think, and whether this is a public sector or private sector responsibility, I think it's the responsibility of both. And more importantly, I think the responsibility of the community to educate about these devices and the choices, the impact of choices that we are making, right? For example, a lot of us probably have an Alexa device at home. And I think not everyone probably knows how much data is being collected by this device about your personal discussions or so forth, and how that data is being used, until there is an uproar from the community as to we can use data only in certain ways. So I think to avoid such scenarios, just given that this is such a critical and personal information, it is very important to be proactive from the community side, on the public health side, to educate people of how this data is being used. And typically not with loads of these documents, but I think in simple, informative ways that people can absorb and make the choices, right choices for themselves. So, and then the private sector's responsibility is to show perhaps the benefits of using these technologies as well. So I feel like they both have to work collaboratively to kind of educate and also show where the benefits lie and what are some of the things what's the price you're paying to get that advantage. Yeah.
Thank you so much. Suja or Dr. Bridger, do you guys have anything else to add? Or
So Joyce, living in the world of AI, working with data, technically, like, in a common, I'm not just getting the right word, in an ideal world, like we would think, in order to maintain competitiveness, even between various public sectors or private sectors, like in order to maintain competitiveness, you hold on to your data, like, that's where your edge comes from. I think we are living in a world where we are gathering huge amounts of data, and we are not even able to understand what the data can do for us. There's so many ways of building. There's so many ideas that, exist out there, how the data can be used, how, artificial intelligence, at various levels, can be used. However, I think we should be open to a culture of collaboration. So I think that's where the private and the question is, what is the public role and what is the private role? I come from a Canadian healthcare background, so we are mostly public. However, we do take the help of the private entities to flow the outcomes. Whatever the outcomes that we have is for the public good. So I put a different lens to the healthcare providers in US. But whichever world that we live in, I think the being collaborative, especially in the world of data, trying to even building models so that we can dispel that bias, and then, build the models that has the best outcomes, I think is required. So I would say just build a collaborative platform for data sharing and access and outcomes.
Thank you for that. That kind of reminds me a little bit about what Dr. Bridger, you were touching on when you were talking about incorporating people, who are maybe not necessarily at the top of the decision-making process, but those who are most affected by the decisions, to help find those solutions in a collaborative manner. Do you want to kind of speak to what that might look like as more AI or as more data-driven solutions are implemented in the healthcare space or other, mission critical spaces for us as a people, if we don't pursue those kinds of opportunities for collaboration, or, any of your thoughts moving forward on that?
I think specific to AI, we really have to get at the issue of trust, because so many people think of AI and they think of all of the different movies they've seen where the AI becomes the ruler of the people who created it, right? And I know that that's not really how AI works, but that's about all I know about AI. And so I think we need to help people understand it really goes back to the how are we using it. So having them help to create what it is that the output from the AI looks like, I think goes a long way in building that trust and gets at the same, I mean, it's data, right? I would say the same thing about any other kind of data. People need to be involved in what the final product looks like before you start to collect the data. And so that, you know, and I say that in the middle of a pandemic, which is an emergency situation. And sometimes in emergency situations, like you can't, I often use the fire department analogy, right? You don't go up to the firefighters while they're in the middle of putting your house's fire out and say, well, have you really considered if your water output is the perfect strength? You don't do that. So that's the other thing we have to balance here is sometimes in an emergency, you do the best you can with what you've got. But if you've got a history of involving the people who are your data points in making decisions about how that's going to be used, you build that trust, then I think you're in a much better position in the middle of an emergency to say, trust me, we're in the middle of an emergency. When we're done with all of this, we'll sit down and figure out how to do better next time. But we have to find that balance.
Amazing. Thank you so much. Well, we're approaching the time for breakouts, so I'm about to pass this back to Leslie so we can coordinate the remaining part of the discussion. But Dr. Bridger, Dr. Kuruthipudi, and Suja, thank you so much for your insight today and for the discussion. We absolutely appreciate your perspectives, and I think that this is going to lead to some really great conversation in the next portion. With that, Leslie, thank you.
Thank you so much, panelists, and thank you, Joyce, for facilitating our discussion there. There's so much knowledge gained, I think, particularly around the AI portion. A lot of that is really new and confusing to most of us out here, and getting a better grasp on that is really important since it is something that is being used and is going to continue being used, and something we all need to get more educated on. And just all of the points you're making, this is just so wonderful. And I think another thing that we keep talking about each week is just how all of these pieces we've talked about touch each other and mingle with each other, and how the identity, the reach, the trust, I mean, it all, you can see so easily when we jump into these discussions how it all matters. It all matters so much. So thank you again for your time and for your expertise. We're going to hop into the last bit of our event today, and that's going to be our breakout room discussion. So we're going to hop into a breakout room with attendees and with Giselle Prado leading some questions for us. And the panelists, you're welcome to hop off for the day. Thank you so much for your time. Right before we hop into our breakout room though, I did want to remind everyone that you can go to our CivTechSA.com website and go to our community conversations tab. I'm going to go ahead and share my screen real quick and show you all exactly where to go. Let's see, pull it up. So on our website, what we have is not only the recordings from the last 2 weeks, we will also be putting our recordings from this week on there as well. If you scroll down, you can see that we have a Metro Health case study up. So we have this priority health survey that Metro Health conducted a couple years ago, and they've provided us with the documents behind that case study, which you can access right here at that button. And we want you to look at that. We want to get some feedback around how their process might have had some bias in it, how they could have maybe reached more people, or were they asking the right questions? You know, this is really all about you guys responding to something that they have done, so that we can get a better idea of your thoughts and your ideas around it, because we're always looking to improve. That's what this is about, right? Really looking at the issues that we're facing and how to make it all better. So, and we can only do that with you guys continuing to participate. So we want you to look at those case studies here. If you click there, there's a public board that we're posting these responses to via Trello, which is really cool. So when you submit your responses, they will end up there. I'll also be adding some of the responses in these conversations in the live event on that Trello board as well. And this is where you share your perspective. So you can give us some feedback on any one of these topics or on the health priority survey, and just anything else in general. We really want to capture as much content as possible from you guys around your thoughts, your ideas, feelings, anything you're thinking of on this topic, because it's really, this is about connecting with the community on what we can do better moving forward. And that's from a tech perspective as well, and as well as the city for policy. You know, a lot of the ideas I've had during these community conversations is, you know, what kind of events can we have here at Geekdom and as part of CivTechSA around building new survey tools or coming up with a better system or application to store, share data, etc. So I've got a lot of ideas going, and those will only get better with your participation. So thank you all for attending again. Please go to our website, give us more feedback, stay in touch. This is a conversation that will not end. We will keep working on talking about this internally, externally, all together. We're really excited. So thank you again to our panelists, and thank you to everyone participating. We're going to hop into our breakout room, so you should all get an invitation to hop there right now.